Well, good afternoon. This is a COVID update for November the 10th, 2021, and I'm joined today by Dr. Eileen de Villa, our Chief Medical Officer of Health, and by councillor Joe Cressy, the Chair of the Board of Health. We are continuing to make great progress as a city in getting eligible residents vaccinated against COVID-19. More than 84.5% of eligible residents are now fully vaccinated, and almost 88% of eligible residents have at least one dose of vaccine against COVID-19. So that means in total we've administered more than 4.95 million doses of vaccine to residents of the City of Toronto. As Dr. de Villa will detail, we now have a new challenge in front of us, which is 200,000 kids between the ages of 5 to 11 who live in our city. They aren't eligible to be vaccinated yet, but that day is soon to come. While we are still awaiting Health Canada approval of the COVID-19 vaccine for kids, we are doing all of the work we need to do so that we're ready when the time comes to help deliver these vaccinations. I'm proud to announce today that we're launching the Team Toronto Kids COVID-19 initiative, the vaccination campaign to get these kids vaccinated. This campaign is going to be led by Toronto Public Health, and it's focused on helping kids get vaccinated so they can have the best protection against COVID-19, so that their families can be better protected, and so that schools can be better protected and stay open, perhaps most important of all. Like our approach to the larger vaccination effort, this campaign is data-driven and focused on making sure that all families, no matter where they live in the city, no matter what their circumstances, have access to the information they need to make a decision about vaccination and access to the vaccinations for themselves. The campaign rests on 5 pillars: clinics, community engagement, community outreach, partnerships, and making sure we have a needs-based and equity focus. And I commend Councillor Cressy for the leadership role he played in putting this kind of a framework together, which I think will guide us well, as it has during the rest of our vaccination campaign that's been so successful so far. Not over yet. We're in the process now of planning clinics across the city, including school clinics, in partnership with the school boards and at family doctors and pediatricians' offices. Our kids' clinics will include superhero selfie stations to make the experience fun and comfortable for kids. We want them to feel like they're superheroes in getting vaccinated, because they are. And we want to make sure that they experience it in that way as kids would, and that the experience is a very positive and fun one for them. We're also planning many other clinics to help make the vaccine as easily accessible as possible. We've talked about our community engagement and community outreach efforts for the overall vaccination campaign before, and we will be continuing with this grassroots approach because it works. We have already launched webinars and town halls for parents and caregivers and guardians. Those will be continuing, and we'll have more than 300 neighbourhood ambassadors and 155 community agencies helping us with that work. But we also know that we have to work to make sure the vaccine rollout helps everyone, everywhere across the city, without exception. To support kids in equity-deserving neighbourhoods, school-based clinics will be rolled out with enhanced outreach in 30 neighbourhoods across the city. And again, this is data-driven. The criteria for selecting priority neighbourhoods for school vaccination clinics looks at a variety of measures, including the COVID-19 fourth wave case count in the last few months, the percentage of residents who fall below the low-income measure, the percentage of residents who identify as racialized, the percent of people living in more crowded housing, and the total population of 12 to 17-year-olds not fully vaccinated as yet. We will adjust this as needed, adjust these criteria as needed, and as the data changes, but it's about making sure that we look at where a concerted vaccination effort is most needed. And it will make the biggest difference and protect the most kids, because that's what this entire campaign for adults and kids alike has been all about. That's what it's about at the end for this particular part of the campaign: protecting the kids. We all want this pandemic to come to an end, but it can't end if kids aren't protected. I know that there are people out there who have some concerns about the vaccination of children. It's okay to have those concerns, and we want to make sure that we get as much information into the hands of people as possible to help to allay those concerns, information that can come from trusted sources. But I also know that the vast majority of people have already looked at the information available. They've already asked trusted sources for their advice on this. They have received their vaccinations themselves and made a decision about their own lives, and now they want their children to be vaccinated too. Our Team Toronto Kids vaccination campaign will make sure that the success we've had getting residents vaccinated continues, and that everyone across Toronto from age 5 to 11 can have the best protection available against COVID-19. which is and continues to be vaccination. As we get closer to Christmas, the malls will be filling up, and we want to continue to make sure that vaccines are available where we know people are going to be. We know that the easier it is to get vaccinated, the more people will get vaccinated. Again, we have millions vaccinated already, and we're down to the thousands that we need to get their vaccine doses to get us to the 90% objective. That's why we've had several successful weekend shop and vax campaigns, and we're going to have another one, more than one, in fact. But this weekend, starting tomorrow, November 11th through Sunday, November 14th, Team Toronto is hosting COVID-19 vaccine clinics in 15 malls around the city. People will be shopping in those malls starting as early as now, but going through Black Friday, going through Hanukkah and Christmas. And we're going to take the vaccines to where the people are going to be. And we're going to have shop and vax this weekend. Some of these are walk-in, some are by appointment only. Some will administer third doses as well as first and second, and still others might deliver the flu vaccine as well. It is important that anyone who hasn't been vaccinated against COVID-19 does so as soon as possible, especially as we move into the colder weather and more people are spending more time indoors. The vaccine is safe, and we want people to have as much protection as possible ahead of the holidays, when they're more likely to be out and about or more likely to be gathering indoors with friends and family. Shop and Vax makes it as easy as possible for people to get vaccinated because you're out and about doing your shopping or other errands already, and this makes it very convenient for you to add vaccination to that list. Shop and Vax will feature clinics at the following malls and shopping centres, including the Agincourt Mall, the Bridlewood Mall, the Cedarbrae Mall, the Cloverdale Mall, Eglinton Square Shopping Centre, Gerrard Square Shopping Centre, the Lawrence Allen Centre, the Parkway Mall, the Shoppers World Danforth, the Thorncliffe Park Community Hub, the Scarborough Town Centre, the Stockyards Village, the Woodbine Mall, the Young Shepherd Centre, and the Yorkgate Mall. In addition to all of these choices, Team Toronto and its community partners are operating dozens of other local clinics in neighbourhoods across the city. And you can find a list of all of these clinics, including the malls for Shop and Vax and the neighbourhood clinics at toronto.ca/COVID-19. And people, of course, can also visit more than 450 pharmacies across the city that also are offering COVID-19 vaccinations. I invite everyone born in 2009 or earlier who is not vaccinated to please find some time over the next 4 days to visit one of these malls or other clinics or a pharmacy to get their shot while they work or play or while they're just out and about. We're able to do all of the things we're able to do now in terms of being able to be more active in the community and be together and be in places we want to be, like restaurants and other places like that, because of the fact that so many of us have already done the right thing and got vaccinated. So please, if you're not vaccinated, please make the right decision this weekend for yourself and for your city. Finally, I want to acknowledge that tomorrow is Remembrance Day. I look forward to attending the Remembrance Day ceremony at Old City Hall, which has returned to its more normal setting outside of the Old City Hall in front of the cenotaph, knowing that people will be able to honor those who've paid the ultimate sacrifice for our country, those who have served and those who continue to serve in a manner that is more customary from previous years before the pandemic. Remembrance Day services beyond the Old City Hall will also be held at the following locations: the Scarborough War Memorial, which is 90 years old this year, at Danforth and Kingston Roads; East York Civic Centre Memorial Gardens at 850 Coxwell; the Etobicoke Civic Centre Cenotaph at 399 the West Mall; the York Civic Centre Cenotaph at 2700 Eglinton Avenue West; and the Fort York National Historic Site at 250 Fort York Boulevard. We've come a long way since the last Remembrance Day, thanks to the vast majority of people following public health advice and getting vaccinated. I encourage all Torontonians to take the time on Remembrance Day to pay tribute to the fallen and honor our veterans, those who've served our country and those who've helped us to be in the free country of opportunity that we live in today. Wear a poppy. Learn the stories of these men and women who served us. Take time to pause and remember at 11 o'clock in the morning, and if you're able to, please attend or watch one of the city's ceremonies. It is so important to remember. And now I'd like to ask Dr. de Villa if she will speak more about the Team Toronto Kids Vaccination Campaign and provide her report for today.
Thank you, Mayor Tory, and good afternoon. Today You've heard about the details of our 5 to 11-year-old vaccination plan, a needs-based, data-driven, and equity-focused plan providing access to COVID-19 vaccinations to the more than 200,000 5 to 11-year-olds living in Toronto. We hope for and anticipate approval and delivery of the vaccine for this age group later this month. When the vaccines are available, many parents and caregivers will want their children to be vaccinated as soon as possible, and we're prepared to meet that demand. We also expect that there may be some parents and caregivers who have some questions about having their children vaccinated against COVID-19. It is completely normal and expected to have questions about these vaccines. Some may even wonder if vaccination against COVID-19 is even required for their children. It's true that in general, children have a much lower risk of severe outcomes and hospitalization compared to adults after contracting COVID-19, even when exposed to the Delta variant. However, children in Toronto, specifically 4 to 13-year-olds, currently have the highest reported case rate out of any other age group in the city, and they have had since late this summer. And while severe outcomes for children are rare, they do happen. All over the world, children have been hospitalized, treated in the ICU, and tragically, some have died as a result of COVID-19 infection. Of those infected, a small number of children develop a life-threatening condition called multi-system inflammatory syndrome in children. Others may have lingering symptoms for months after infection. And unvaccinated children, even if they do not become very ill themselves, can spread the virus to family members, friends, and others they interact with regularly. In Toronto, we have seen how easily COVID-19 spreads within a household once one member becomes ill. Vaccinating the entire family against COVID-19, including children, is an important step to protecting all the members of the household, including elders and those with chronic health conditions. Like many of you, I've been watching the rollout of the 5 to 11-year-old vaccinations in the United States over the last several days. I noted that First Lady Jill Biden chose to attend an elementary school in Virginia to promote vaccine confidence and uptake, at the same elementary school where the first polio vaccines were administered. I think that was a fitting choice, not only because of the symbolic nature of the visit, but because vaccination so often relies on the partnership between public health and our colleagues in education. This has been true if we look at our collective efforts to battle childhood diseases in the past, such as polio, smallpox, and diphtheria. Education about vaccination is vital to ensure parents and caregivers have all the information they need to make informed decisions on behalf of their children. In order for a vaccine to be licensed for use in Canada, it must pass a rigorous process to demonstrate that they are safe and effective. As with all other aspects of the pandemic, the science is developing quickly. Only yesterday, a study was published in the New England Journal of Medicine on the effectiveness of COVID-19 vaccines for children. The available science confirms that vaccinating our children will protect them, their families, and our community against the virus. If you're a parent of a 5 to 11-year-old child and are unsure whether or not to vaccinate them against COVID-19, when you're able to do so, I encourage you to reach out to a trusted, knowledgeable source of information, like your pediatrician or your family physician. Please also take advantage of one of the many outreach and education opportunities that are being offered by Toronto Public Health and our Team Toronto partners. We will continue to help parents make informed decisions through information sessions, question and answer sessions, our Toronto Public Health Hotline, hospital consultation services, and town halls. Until all children can be vaccinated, I urge all those who are eligible but have yet to do so to receive their COVID-19 vaccine. I also ask you to continue to be vigilant. While it's true that in Toronto, the number of reported cases continues to be relatively low, we are monitoring a slight increase in COVID-19 activity, as demonstrated through our 7-day moving average for new COVID-19 cases and our weekly incidence rate. We are also seeing many jurisdictions around the province experience a rapid increase in COVID-19 activity. So I ask that you please continue to assess your personal risk, how you are interacting with others, and continue to employ measures like masking, physical distancing as much as possible, and taking advantage of this unseasonably warm November weather and taking activities outside. You will be protecting your families, your friends, and individuals at greatest risk of severe illness and those who are not yet eligible for vaccination. Through these measures, and of course, through vaccination, you will be doing your part to help bring this pandemic to an end. I'll now turn the podium over to Councillor Cressy.
Well, thank you, Mayor Tory, Dr. de Villa. Team Toronto Kids will be the largest kids vaccination drive in our country's history, and we're now ready to roll it out. Over the last year, we've developed many tools to run a successful vaccination campaign. We've also learned a lot of lessons along the way. Now, we're taking all of those tools and all of those lessons and putting them to work for our kids. So, Team Toronto Kids. First, it's about accessible clinics. We've learned that you need to bring vaccines directly to where people are, where they work, where they live, where they shop, where they commute, and where they hang out. With 200,000 5 to 11-year-olds in our city, the Team Toronto Kids campaign will include a multi-pronged clinic approach, with clinics at schools, at hospitals, doctors' offices, and local community locations. It's about making sure that getting a shot is as accessible and easy as possible. Second, community engagement. We know that parents and kids will both have lots of questions about vaccination, and vaccine confidence is critical to vaccine uptake. That's why Team Toronto Kids includes webinars, telephone town halls, information hotlines, toolkits, and more. We're using every tool we have to make sure that families have every opportunity to ask those questions and get those answers. Third, community outreach. A successful vaccination campaign meets people where they're at. That's why Team Toronto Kids will use our community mobilization model to connect with families in their neighborhoods, in their schools, and in the languages they speak. Over 300 neighborhood ambassadors and more than 150 community agencies across our city will be on the ground, building trust and sharing info. The fourth pillar here is partnerships. When we talk about Team Toronto, well, Team Toronto is more than a name. It's actually how we succeeded throughout this entire vaccination campaign. Team Toronto Kids is no different. It's a huge team effort. And fifth, our fifth pillar is equity, bringing vaccines to the most vulnerable as quickly as possible. That's been our approach, a critical approach for vaccinating adults, and the same will be true for kids. When vaccines are approved, every single 5 to 11-year-old will be able to book a shot in our city. However, we've identified 30 neighborhoods to bring increased school-based clinics and outreach to. And the final piece here is we've learned an important lesson about fun. We're talking about vaccinations, we're also talking about fun. We've helped millions of Torontonians get their shots with DJs, live music, even events that set world records. Getting a vaccine is an act of civic duty. It's about protecting yourself and your city, but it should also be a celebration. It should be fun. And so with our Team Toronto Kids campaign, we're working to make clinics a fun and positive space. Our Team Toronto Kids logo is a family of superheroes. Clinics will have superhero selfie stations. Frankly, kids across Toronto will have a chance to roll up their sleeves and be a real superhero. In this immunization campaign, millions of Torontonians have already stepped up. Now it's our time, our collective time, to step up and protect our kids. That's what Team Toronto Kids is all about. With that, I'll turn the podium back over to Mayor Tory, and we'll open it up to Lavin to facilitate questions.
Thank you, Mayor Tory, Councillor Cressy, and Dr. de Villa. We will now take questions from the media. As a reminder, it's one question, one follow-up, and when we call your name, we will unmute you. We also do have staff on the line, Carlton Grant from MLS, and Janie Romoff and Howie Dayton from Parks, Forestry, and Recreation. First up, we have David Ryder from The Star. Go ahead, David.
Good afternoon. First question for Dr. de Villa. It sounds like in your messaging you've gone from, we hope that we'll have approval and administering vaccine within weeks until later this month. I'm hoping you can elaborate on exactly what you've heard and when you expect that these clinics with the selfie stations and everything else will actually be operating and kids will be protected.
So David, thanks for the question. And at this point, we are November the 10th today, so a couple of weeks is pretty much close to the end of the month. I think we are still very much tracking towards the end of November, but of course, that all rests with Health Canada. And what I trust is their very rigorous process. We certainly want them to make sure that they're doing the licensure process and that they're doing their review as rigorously as they always do. And we will, of course, be ready for them when they finish their review and approve the product. We're ready to go here on the ground, as you've just heard us speak to.
Thank you. And I guess I'll follow up, I think, also for Dr. de Villa, but maybe Mayor Tory if he wants to add anything, which is I've heard some commentary saying that with the daily cases rising again after a sustained drop, that maybe it's time to look at backtracking on not having capacity limits on indoor dining, having full sports stadiums. Is there a scenario in which, even if the province doesn't do it, that Toronto moves and looks at rolling back the clock a bit on the reopening?
So, you know, David, I think we can safely say that throughout the entire course of the pandemic, our actions here at the city have been guided by data and the best available evidence. So I think the people of Toronto can come to rely on that Toronto Public Health and the City of Toronto will guide its actions in respect of the COVID-19 response based on the best available data and the best available evidence. And at this point in time, what that looks like is, as you just heard me say, continued vigilance on the part of Torontonians, as they have done for so many months now and have been so successful at. Keeping that distance, wearing the masks, staying home when sick, washing hands. You've heard this advice time and time again, but of course now, what we have in our toolkit is vaccination. We have seen the incredible impact of vaccine, how much it has actually taken us, how much progress we've made over the course of the time that vaccines have been available. And soon we have the prospect of this really incredible and effective tool soon to be available to our 5 to 11-year-olds. So again, public health measures, vaccination of those who have yet to get vaccine now and are eligible, and vaccination of our children as soon as they are eligible to receive vaccine. This is what will see us through and get us to the other side of this pandemic. I don't know, Mr. Mayor, anything you wanted to add?
I would only add this. We asked Dr. de Villa, who's given us such balanced and professional advice throughout this pandemic, at the beginning of this fourth wave and when the Delta variant became a major issue, what should we be doing? What measures should we undertake beyond those that were in place at the time? And the response was that we should put the most effort we possibly could into getting people vaccinated, and that's exactly what we did. And I think we've done it well in the context of reaching out to different parts of the community, employing ambassadors, having clinics all over the place, and doing everything we could to take vaccines to the people. And I would say that for the moment, while we talk about this every day, we monitor this every day, we're advocates and also partners with the province in talking about this most days, if not every day, our top 3 priorities remain the same: vaccination, vaccination, and vaccination. And that's what we're going to continue with, as the Shop and Vax indicates, as the program for the kids indicates, because that is the single best thing we can do to keep numbers that are down where they are, together with people just exercising common sense and things they've learned and done so well over these many months.
Thank you, Dave. Next up, we have Mark Douglas from City News 680. Go ahead.
Thanks, Lavin. Question for Dr. de Villa. So if I heard properly at the beginning, there were some audio issues, but if I heard properly at the beginning, I think the number was 84.5% now of the city's eligible population is fully vaccinated against COVID. The goal, of course, has always been to get 90% of that population fully vaccinated. Is the climb to that goal of 90%, is that climb slowing down? Are we now getting some doubt that many people are willing to get both doses of vaccine?
You know, Mark, I would say this. Over the past several weeks, you've heard us talk about this campaign and making sure that we're getting vaccine out to as many people as possible. The goal is to get as many Torontonians vaccinated as possible. And we've also said over the past many weeks that as we get higher and higher, as we get to, you know, the last stages of any campaign, whether it's a vaccine campaign or any other kind of initiative, the last stages always take a little more effort and take a little more time. But you have seen us continue to use those strategies that have worked well for us and that continue to work well for us, and we adjust and adapt our course of action as we have throughout the course of the entire pandemic, in keeping with what we're seeing on the ground that actually works. So making sure that people have access to vaccine, bringing vaccines to places where people live and work and play, this has really been a very substantive and has made a huge difference in our vaccination efforts. So you're going to continue to see us do that. And we are continuing to see that when we bring vaccines to people and when they get the information they need and have that opportunity to talk with trusted members of their community, community ambassadors, trusted healthcare providers, you know, people who they already have established relationship with. It's that combination of making vaccine available and answering questions that has served us well, and I expect will continue to serve us well as we continue on with the vaccination campaign, and especially as we bring that vaccination campaign to 5 to 11-year-olds as soon as that vaccine is available.
Thanks. And another question for Dr. de Villa, just on the topic of, you know, kids and having fun and the shopping and all that, holiday shopping well underway. Are shopping mall Santas allowed this year? And can kids actually go up to the Santas and climb up on their laps and sit on their knee? Is that going to be okay with COVID protocols?
Well, I think at this stage in time, much of what is driving COVID protocols is outlined in provincial legislation. The Reopening Ontario Act actually describes what is allowable under the current conditions. Clearly, we want people to have fun. We know that this has been a long and challenging time for the pandemic. You've heard us talking about fun even within the context of clinics. I don't know that that's something that is always at top of mind when people think about vaccines, but we do think that we have an opportunity to really create more of a fun atmosphere and bring fun back into our lives, something we've missed so much over the last almost 2 years now. Please.
I actually, Mark, would like to just comment on the first part of the question, but I will say that there would probably be a number of kids out there who would welcome any opportunity not to get too close to Santa Claus, based on my own experience as a father and grandfather. I wouldn't want the impression to be left in terms of this whole business of things slowing down, as it were, that we're not achieving incredible success. You know, we knew from the beginning, as you would know from a campaign that a company would use to get people to change their technology, or as you would know from the red and white health cards, and there's still some out there, as you would know from a fundraising campaign where the last dollars are the hardest ones to get in. We knew that the build it and they will come approach would work at the beginning, because there were lots of people who wanted to flock to get vaccinated. But we also knew there were people who were hesitant about that for a number of reasons. We worked so hard with our ambassadors and with education campaigns and so on. And we are making steady progress. And we're making steady progress already at numbers that are globally, not just globally respectable, but are globally leading in terms of the percentage of people in a big global city that have become vaccinated. And so we're going to get to 90. There is no mistake about that whatsoever. There's no wavering in our determination, but we had to make a major shift from Build It and They Will Come to take vaccines to the people. And that's what we're doing, but that is a harder thing when it's done person by person, 10 by 10, block by block, building by building, mall by mall. It's harder than when you can build a mass vaccination clinic and people will come to you. And so I'm very optimistic about our prospects for getting to that goal, and I think that is the impression that people should be left with, because it's just the truth that we're doing very well thanks to literally millions of people who step forward and become vaccinated. Almost 5 million doses administered in this city alone so far.
Okay, next up we have Miriam from Radio Canada. Go ahead, Miriam.
Good afternoon. My question is for Mayor Tory about childcare. Doug Ford says he is not in favor of side deals between the federal government and municipalities on this issue. At the same time, negotiations are not progressing rapidly enough for parents. And I understand there is a motion in front of a city council to know what options Toronto has to maybe partner directly with Ottawa if an agreement is not reached. So I'd like to hear Mayor Tory and perhaps Councillor Cressy on this.
Well, I will just say my responsibilities, of course, are with the people of the City of Toronto and on their behalf in terms of the need they have for as much help as they can get to have accessible, affordable childcare. But I still think, notwithstanding that my job is as Mayor of Toronto, that it is preferable, highly preferable, for there to be a deal involving the entire province of Ontario, because I'm mindful of the fact that, for example, so many of the people that work in our city day by day, in fact, live in some other part of the province, and they too need access and should have access to more affordable and more accessible childcare. And so I'll say what I've said before about these kinds of things when there's these supposed impasses between these governments, which is they should go in a room and they should agree to stay in there until they come out with a deal. Because from the standpoint of Ontario, these are billions of dollars that can be made available to our residents, really, in the end, for purposes of helping them with their childcare expenses. And from the standpoint of the federal government, I think they want for there to be here a national program which is beneficial to families, but it's also very beneficial to the economy, to greater equality when it comes to the participation of women and parents in the workforce generally. This is all good news. So I would just hope that they will continue with their discussions and that today's impasse will become tomorrow's agreement. It would be a great Christmas present for the people of Ontario to know that their province had signed on to this childcare arrangement across the country.
I would just echo Mayor Tory's comments in their entirety. Affordable and accessible childcare is not a nice to have. In fact, it's necessary to recover from this pandemic and to ensure a recovery for all, especially for women. And certainly as a city, we want to do everything we can to support that national program and to support our provincial and federal governments coming to the table together. And I think it's important for us to do our due diligence to understand how we can best support that. But we need a national program, and as Mayor Tory articulated, that's something we'll continue to work hard to support in any way we can.
My second question is from my colleague Stella for Mayor Tory. The City of Toronto will be pausing a number of recreation classes this week due to staffing impacts of the vaccine mandate. Should we expect other reductions in services?
I really hope there won't be the need for any reductions, and even in the cases where there have been reductions, and I'll indicate how many there have been, we're in the process of looking for ways in which we can rehire and redeploy people so that we can keep as many of these programs going as possible. But at this moment, on account of some of the changes that have taken place by virtue of choices people have made about vaccination, we've had affected 69 out of 6,400 recreation programs. The total number of people enrolled in those programs affected at this point in time is about 400. That's out of more than 44,000 participants in the programs. And it also involves, just from the standpoint of the people that have made the choice they have, 40 staff out of a total of 3,000 part-time recreation workers. So that, I think, and the good news is that more than 90% of our recreation workers are fully vaccinated. So we're going to carry on trying to get people vaccinated. Again, our priorities are vaccination, vaccination, and vaccination in that order for our own staff team members as well as for the public. And as we continue to have success with that, we will have less and less impact on programs. And so we're planning to get back to full strength as opposed to any other kind of consequence.
Thank you. And lastly, we have Adrienne from Citi. Go ahead, Adrienne.
Hi, thanks so much. My first question for Mayor Tory. This week's City News has been investigating whether or not Toronto bars and restaurants are enforcing the vaccine certificate mandate set out by the province. We've attended multiple establishments, and from the establishments that we've been to, the majority have not been enforcing the vaccine certificate mandate. Either they're not asking to see it, or they're not scanning the QR code, or they're not asking to see ID with the certificate. We sent your office our story from yesterday with some video that we captured of us going into restaurants. Wondering if you could respond to that, Mayor Tory, and respond to multiple restaurants. And some of these are large chains right in the downtown core that aren't checking vaccine certificates.
Well, first of all, I'll say that my own personal experience, where I've probably been a dozen places at least since the vaccine proof has been required, my experience has been without fail. They have asked me for both my QR code since that's been available, and prior to that, the printout from the COVAX registration system and my identification. And I think that that is the experience many people are having. I saw the report on City TV with respect to some places that weren't following that through, although in some places it seemed to take place in installments and so on. I think that all we can do is remind people, which we will do and continue to do, of the fact they have this responsibility to ask for both the proof of vaccination and the ID in order to make sure it's the same person. But we really have to rely on people as well, both people, the individuals, and the individual businesses, because in Toronto we have literally thousands of restaurants. It is not practical or possible that we're going to have somebody, enforcing and making sure that enforcement is taking place at every single one of those places. I think people are doing a great job. I think when they've had to add this to their responsibilities, the small businesses, many of them in our city, are doing a fantastic job at getting this proof of vaccination. I think people are being incredibly cooperative. I've watched from some distance in some of the places that I've gone to, including some fairly big crowd scenes, and I haven't seen anybody pushing back and resisting. People are cooperating because they know it's in their best interest and in the best interest of keeping those businesses open. And I think the main reason I would advance, besides the fact it's the law and besides the fact it's about collective public health, is that the best way in which those very same establishments are going to stay open, without fail, is if they carry out this duty that they have to do for now of asking people for this proof. And I'm confident they will do that. We will remind them of that, and I think this story helps to remind them of that. So in that sense, I'm appreciative of it, but we're on top of this as best we can be, knowing we can't be every place at one time.
Thanks. My follow-up question, which might be better answered by maybe Carlton Grant, who I believe is on the call, or perhaps Mayor Tory. When it does come to that enforcement, are you able to say how many tickets have been handed out to establishments that haven't been following the mandated vaccine certificate program? We're talking about bars and restaurants and other businesses who haven't been asking for vaccine certificates and letting people in.
Carlton, we gone ahead and muted you, so you can go ahead. Thanks.
Okay, thanks, Lavin, and thanks, Adrian, for the question. It's Carlton here. And I can first echo the comments of the mayor that I've had the same experience with attending restaurants that I've been asked for both my QR code and my identification. And also just confirm there's over 8,000 restaurants in the city of Toronto. We have, this is a joint enforcement effort between public health and MLS. Public health is really responsible for bars, restaurants, nightclubs, sporting events, concerts, movie theaters, and MLS is responsible for gyms, fitness clubs, and adult entertainment clubs. And as a group, we collaborate on this, and I guess since it's come into place, we've received about 900 complaints. And again, between public health and MLS, we've gone out and inspected over 1,336 of these. And so far to date, while we have not issued tickets or charges, we have issued a number of warning letters, 5 warning letters to different restaurants. But again, our objective is to work with these small businesses, inform them of their requirements, as the onus is on the businesses to check this information. And that's something we've been doing very actively.
Okay, that's it for today, everybody. Thank you and have a great rest of your week.